It's time for Veterans Issues, the show that brings you information about veterans, military, and their family. Now here's your host, Ken Rollins.
Welcome into Veterans Issues. Ken Rollins here. Today we got two guests, and they're from the Birmingham VA, the VAMC, and one of them is Dr. William Harper. Is the director, acting director. We won't call him the director because he's doing all the duties of the director. And our buddy is Jeff Hester is back down here. He's a public affairs. This got all, and nobody's working in the, I'm kidding you. They're all at work. Be right back with VA. Welcome back to Veterans Issues. Appreciate you tuning in this week. Today, I've been trying to get this guy back down here. He was here once before, but he's got so many things to do. He's a very busy man, and we wanted to talk a lot about talk about things that we've talked about on here about the new VA work that's going on over there in Birmingham. We're going to get an update on all that today, and Jeff Hester, the public affairs director from the VA, is here with us. And we're going to, all the things that you wanted to know about the VA in Birmingham, and then some questions that you didn't want to ask. We're going to do that today. Welcome back to the show, Doctor.
Thank you.
Jeff?
Yes, sir.
Good to see you, man.
Yes, sir.
It's good to see you, Doctor. Appreciate you taking time out of your schedule. And
Thank you. Well,
you're the acting director still?
acting director.
What's that been, about 10 years now?
Seems like it.
Seems
but it's only a little more than 6 months.
Yeah, and Mr. Smith is over in Vision 7.
He's the interim Vision Director for Vision 7.
Yeah, and that's, but you still got all the duties. Let me just give you this. How's the VA doing in Birmingham?
Actually, the VA in Birmingham is doing quite well. There's a program called SAIL, another acronym, but it has to do SAIL, S-A-I-L.
Okay.
And it's a program by which the VA looks at not only quality of performance, but efficiency of performance. They look at access issues, they look at patient survey results, those kinds of things. And we just found out last week that, well, let me back up. SAIL has a 5-star program. 1 is not so good, 5 is as good as it gets. And you're compared to other facilities around the country. So we are currently a 4-star facility, actually moving up toward a 5, but 4-star right now. And according to the information we got from the VA central office, we're 30th in the country on the SAIL data. So there's 121 healthcare systems across the country, and we're number 30 as far as the quality of care and efficiency of care.
Wow, that is so awesome, man. Jeff, you've been over there how many years now?
25.
25 years.
Started back in 1990,
Yeah.
right out of college.
How do you feel about, put you on the spot, how do you feel about VA today versus 25 years ago?
Oh, I feel great about it. When I started back in the 90s, the veterans to me were treated as objects, not as people. Now to me, they're treated as people. They're treated with a lot more respect. I think the quality of health care is a lot better. The care has got a lot more personalized to each veteran. The provider or team of providers knows that veteran as an individual. No longer are they just one of a number. So I mean, to me, huge change over those 25 years. So I'm very impressed with the system and the quality of staff that we have there providing care for our veterans.
That's all we need. The show's over. No.
No, no, we're just starting.
No, I've known Jeff a lot of years, and I was telling you out in the green room out there. You know, I started in the VA healthcare system in Birmingham in the 60s. I don't remember what year. I think maybe 67, 68. And like Jeff said, it was not the most veteran friendly. But I also, on behalf of all VAs, a veteran is probably the worst patient in the world. If I had to treat people because we feel entitled, I don't have mind saying that. I used to go in saying, this is my hospital, you work for me. I remember saying those actual words to people. I disrespected them, but by disrespecting them, I expected respect. You know, that was where we had to learn. Some of us old veterans had to learn the hard way too. But the VA has become veteran friendly, for lack of a better term, that I'm so proud to talk about Birmingham VA. Not because you're sitting here, but these folks watch me every week. I talk about that facility where it's come from and what it is today. And we see one of the hot button issues is politically, it's the VA this from the Arizona things and all that stuff. And we see it down in Montgomery, you know, when the different VA people start talking, that there's a lot of people that get frustrated with the VA. And now we were talking about something that Dr. Harper, I asked that folks call me or let me know one of the things was the phone system, and you was telling me some things out there that down the road is going to happen with the phone systems at the Birmingham VA and the clinics.
Well, let me first disagree with you about one thing.
Okay. Oh, Lord, here we go.
No, it's not. I think you will agree. Some of the finest people I've ever met are patients at the VA. I disagree that they're some of the worst patients. There's a small group that I would qualify that way, but for the most part, the veterans we take care of are wonderful people.
I was one of them, the small group.
Well, maybe you've mellowed as you've got.
I'll just say this. There's a veteran down here in this county. He's since passed on, but he said one day he was sitting there and they called my name over the intercom and he saw everybody behind the door just cringe like, oh, no, not yet. That tells you what
But we have some like that too. To answer your question about the phone system, we've known that we've had problems with the phone system for a while. I've been in Birmingham about 1.5 years, and we've been talking about the phone system and trying to upgrade it ever since. The system itself is old and archaic, and it's had things added to it, so it's kind of pieced together. We've been through, over the last year, we've been through a total upgrade of the system, which was just finished within the last couple of months with the CBOCs, the community-based outpatient clinics. It's still not where we want it to be just because it is cobbled together and they don't always work together. We've had a lot of problems not only with our technology but with our provider not being able to keep up. So we've upgraded the system as much as we can, and now we're finding out that to a certain extent the technology that we have added is overloading our electrical system in Birmingham. And so now we're having to work on that. But I found out last week that the internet people that work with us, they are not part of VHA, which is the Veterans Health Administration. They're part of VA, but they don't answer to us. And so we work in parallel with them very much. And I found out just last week that they're going to upgrade, hopefully by December, the system that we have now. So from a technology standpoint, we're making things better. The other thing is that we've not had the ability in the past to really monitor the phone system and to know when people can't get in or whether or not they're being answered in a timely manner. There's a system called an ACD phone system that's a computer controlled system, and we have added additional 40 lines or licenses so that we'll be able to monitor the phone system much more effectively, to know when we need to add more people, when we need to add other things. So that's in the works. We've just gotten those licenses ordered, and we should have those soon. The other thing that we've done is that we're making a call center in Birmingham. It's staffed, and it's staffed with nurses, it's staffed with schedulers, and it's staffed with people from the pharmacy. So what we're working to do is that it'll be one-stop shopping. If you make a call to the number, then you can go through a phone tree. If you need to talk to somebody about scheduling an appointment, then you push 1.
Yeah, well, I hate to cut you off there, but the satellite's cutting me off here in my ear, and we're going to come back. We're going to take up right there we're talking about the phone. We'll be right back. More with Dr. Harper, Jeff Hester. Welcome back to Veterans Issues, talking to Dr. Harper and Jeff Hester from the Birmingham VA. And when we left, Dr. Harper, we summed it up by one thing you told me about the new phone system, the phone work going on was to work toward when the veteran calls or anybody calls, they'll actually talk to a person that might put them to that department that you're looking for. And Jeff, I wanted to go to you about something. I'm with the State Department of Veterans Affairs. We got a supermarket of veterans benefits coming up soon. Where is that going to be? And
we're going to host that in Birmingham on February the 19th from 10 to 2. So we will be working with the State Department of Veterans Affairs and us in concert. We will have just about every service you could imagine that veterans and their family members will need. So we look forward to working on that jointly, and if there's anybody that has an interest in being part of that forum, to please let me know, or to let the State Department of Veterans Affairs know, the county service officer in that county, and they can get in touch with the individuals that are in charge of it out of the Birmingham area.
They can call me and get in touch with me.
And they can, and you can do that too.
Where's it going to be over there?
It's going to be up in the auditorium at the medical center.
Wow, that's great. Well, any vendors out there that have anything veteran associated, or any of the veteran service organizations, or any of that, just contact
Sure, yeah,
us.
the more the better. Yeah, we'll have to limit it because we have limited space. So it's sort of going to be on a first come, first served basis of who can go up into the room. But we look forward to a huge turnout. It'll be the first time that Birmingham's had the opportunity to co-host this with the State Department of Veterans Affairs.
That's great. Last time we had one here in Anniston, had over 1,000 people. Dr. Harper, every week I do a news you can use. I try to update them on the. Can we do the choice card real quick, like just to update where we are on that? And I want to go to the upgrades over there.
I'll go through this very quickly. Choice started in November of 2014, and at that time people enrolled as of August the 1st of 2014 who lived more than 40 miles from the closest facility and who we could not see within 30 days. That's evolved to the point now that anybody that has been previously enrolled and anybody who are new combat veterans are now eligible for choice. So the eligibility has increased significantly. Initially, it was only if we couldn't get them in within 30 days. Now we're looking at the distance for specialty care, and as well as what's called geo-burden, people who have difficulty getting far enough to
Gotcha.
And we've phased into what's now the second phase. And anyone previously enrolled, as I said, is eligible. And we're expanding it so that we can do urgent consults through the third-party administrator within 5 days.
If somebody wants to know if the choice card covers them, can they call the 9338-101 number and ask for choice, something about the choice, and the operator will guide them to that person?
Yes, they can do that. And the other thing about it, there's a couple of, since I have the opportunity, a couple of caveats, things that we've had that are misunderstandings that lead to bad feelings. The first is that this card is not an insurance card.
Right.
And the approval must be done before it's
Prior.
used. People are going to the emergency room or seeing another doctor and then saying, well, here's my card, and then it's not approved. So wanted to make sure people understand that. Also, one of the requirements through the law is that insurance will be billed if the veteran has insurance.
Right.
And a lot of veterans are reluctant to tell us whether or not they have insurance, but the law requires if they have insurance and don't tell us that they are not eligible for the Veterans Choice anymore.
One thing, I have insurance, and the Blue Cross will bill, the VA will bill Blue Cross on mine, but there's no copay. They don't bill a copay on it. The
Right.
veteran needs to understand there won't be anything. Now, before we run out of time, I want to make sure we get this in. We can go over for a little bit if we have to, but I want to talk about, I've been talking about the parking, I've been talking about the new facilities you're building over there. Where are we today?
Well, let's hit Huntsville first very quickly. The current plan is that on the 31st of October, we will be moving the Madison Clinic into the new Huntsville Clinic. And a week later, on the 7th of November, we will be moving the current Huntsville Clinic into the Huntsville Clinic. And there are 300 plus parking spaces, so that should be more than adequate. In Birmingham, we are looking probably at December, maybe early January to move in there. We've accepted the building. We're still moving the furniture and equipment in. Parking garage still has some work to do as far as installing security cameras and lights. We're hoping to get the parking garage in use before the building, probably, because
Where is this located exactly?
it's between 24th and 25th Street. And between 7th Avenue and University. It's about 5 blocks
From where you are.
from where we are now. There will be round robin vans, shuttles taking people from the main campus there. But the clinic in Birmingham will have a pharmacy, will have a place to go to get blood drawn, and will have x-ray facilities, so that unless they're going for a specialty appointment, not nearly as many people will have to go to the main campus. There will be a pharmacy there as well.
Well,
so the parking will be there in the garage. The clinic is right there, and we're hoping that will unload some of the foot traffic through the main campus.
that's great. The one thing that I guess the biggest complaint over all the years has been the parking. Over there, you had to share with. First, we've been there with the Children's Hospital and all that, and then we moved over to the other stuff. I know either one of you answered this. A veteran is being discharged, and we're getting a lot of them from Alabama coming back from Afghanistan. A veteran is discharged. How quick should they enroll in the healthcare system, or should they enroll in the healthcare, even if they don't have a health problem?
In most facilities where they may be discharged from the military, either by retirement or just serving out their time, they have the opportunity to enroll during their out processing. And we would like for them to do that. If they don't, then we have outreach coordinators that go out into the community and try to reach these people. We have welcome home celebrations in order to try to recruit them. The answer to your question is as soon as possible.
And they can go into the VA hospital there and the eligibility? Or
yes.
Either one of their county service officers to the medical center. But my goal is to always tell them to get enrolled. I've told veterans that for the 25 years I've been there. Many of them says it's for the other veteran, it's not for me.
Yeah.
I've got other health insurance. And then years later, they changed the rules back in 2003. Now many veterans are not eligible for care, but they can enroll, but they're just not eligible for the care because they either make too much money or they don't have a service-connected disability. For me, I always tell the veteran to go enroll. That way when they need us, we're there. So I would make sure they just go ahead and enroll.
I know some field grade officers that Vietnam combat veterans and no, not going to ever do it. Then the systemic heart failure, heart attack.
Right.
Now they into the system. That's what you don't want to do. You don't want to wait. Just want to go ahead.
Well,
and we go down to less than a minute. So I need you to tell me.
I just want to say that we need to let everybody know that for 5 years after serving in Iraq or Afghanistan, you're eligible for free care.
You're eligible for what?
Free care.
Free care.
No matter what.
Totally presumptive.
Did not know that. Did not
Yeah.
know that. And what about a 100% disabled veteran? Do you ever treat the spouses or the children?
We have a program called CHAMP VA, which under certain circumstances, if they are 100% disabled, then yes, they can. Now,
Deceased.
we're governed by the rules of TRICARE, so whatever the age group is for the children, once they reach that age, they're not eligible. But we have 15 or so widows that we're taking care of now.
Thank you for coming out, Jeff.
Yes, sir. Appreciate it
man.
again.
I appreciate Doc. Appreciate y'all so much. I
Sure.
hope that people got a lot out of this, and I know I did. We'll be right back with news that you can use. Stay right there. Welcome back to Veterans Issue. I do appreciate Dr. Harper and Jeff Kester for coming in today and doing the show and bringing us up to speed on some of the things that we've been talking about on here for a while, and they'll continue to let me know what's going on over there, and I'll let you know when you can park in another place. And beside that 2128 4th Avenue, I've been passing on to you. Okay, Veterans Day, November the 11th at 11 a.m. Centennial Memorial Park, 11 Centennial Memorial Park. We're going to have something a little bit different this year. I got the reenactors from the Iwo Jima flag raising. They're coming in to do that, and it looks exactly like the picture you've always seen. And it's a very awesome, very moving presentation. So we're going to have that on there, plus the great music and stuff we have every year. And some of you, I had the people on here from the Birmingham National Veterans Day program, and you got choices if you're in the area watching us. I know some of you going over there, but we got one here in Anniston that is really a great thing to attend. So that's at 11 o'clock, November the 11th, here in Centennial Memorial Park, 17th and Quintard. And so try to be there. Going to have some good things. The legislature, I keep talking about this, unearmarking the funds. If they are allowed to unearmark the funds, It will do away with the Veterans Assistance Fund, affecting our 4 veterans homes, affecting our Department of Veterans Affairs, our cemetery, all those things. If you see Senator Dial or Senator Marsh, tell them that we can't do that. And I'm going to keep reminding you about that. If you hear the word unearmarking of funds, that's basically saying we're going to do away with the Department of Veterans Affairs, do away with our veterans cemetery, do away with our veterans home, and you're on your own. So we're going to take care of, they're going to take care of the Medicaid and the prisoners is what they said. That's the first priority. Veterans don't even count anymore. So I will keep reminding you that. So if you happen to see Senator Dial, you tell him that we cannot unearmark the funds for the veterans. You can unearmark the funds for all the other. Now, the teachers out there are not going to like that because the Education Trust Fund is one of those earmarked funds. But they'll have to fight their battle. I'm going to fight for you for the veterans out here. Okay. For those of you, there's some people out there that don't have it, they can't get us on cable. They can't get us. If you're watching and you can get us, you got to be watching so you're seeing us. So tell your friends that they can go on and send me a friend request on Facebook, and the show will be uploaded nightly, and you can see it on your computer, or you can go to ATT Uverse or some of the other places that carries us. We over in Birmingham, they pick up ATT Uverse over in that area. So pass that on that you can do. Just send me a friend request, or you can go to WEAC TV 24, and on the on-demand button, you can pull up some of the previous shows and talk about them. I want you to remember that tag, that law enforcement tag that's out there, it's a beautiful tag, and it goes to every color car that you could buy, but all the proceeds from that tag go to build the memorials here in Anniston, the law enforcement memorial, the firefighters memorial, the Afghanistan, Iraq. These are the official memorials voted on by the legislature to be located in Anniston, Alabama. That will help build those memorials, but a small percentage goes to the law enforcement memorial up in Washington, D.C. And so look for that. When you go get your tag, ask them to let you see the law enforcement tag, and I'm sure that you'll want to do that. Knowing that your money is, the tag tells everybody that you support the fallen officers, and it'll help build those memorials. This week I want the salute go out to the clinics. Now down in our area you got Childersburg, Southside, and you got Oxford clinics in here. There's some fine people down there. I could name them for you, but I won't. There's some fine people, and appreciate what they do every year. And so this salute's for them. We'll see you next week here on Veterans Issues. Salute.